Okay, our last AML expert for today is Dr. Lourdes wait. Am I muted again? No. Okay. Dr. Mendez's research focuses on acute myeloid leukemia, myelodysplastic syndrome, myelofibrosis, and myeloproliferative neoplasms. Dr. Mendez also has a PhD in cell biology. She is dedicated to both the clinical care of patients with myeloid disorders and translational research to identify novel therapeutics in high-risk myeloid neoplasms and improve clinical outcomes for patients. Dr. Mendez recently transferred from Beth Israel Deaconess Medical Center, where she was the leukemia program leader and an instructor at Harvard, to Yale, where she is an assistant professor and joined the team at the Smilow Cancer Center. I can speak from experience, as my husband spent most of his time at Yale. It is a wonderful place, and we had an incredible team of doctors and nurses at Yale. They must be very excited to have you, Dr. Mendez.
Thanks so much, Karen.
Okay, you can share your screen.
Well, thank you very much for the opportunity to speak today about a really important topic that's actually a very significant unmet need for cancer survivors at large and for individuals living with a diagnosis or a history of leukemia. So we're kind of changing gears, and I thought it might be helpful to start with a brief introduction. In 2024, it's estimated that there will be about 19 million survivors of cancer, a really astonishing number, and an important subset of that group are patients who have had a diagnosis of leukemia. And with this experience of having been diagnosed and treated for cancer, more specifically for leukemia, comes a very important need to manage a very normal and common fear of leukemia recurrence or leukemia progression. And in published studies, this is referred to as FCR for short. So this fear or anxiety about recurrence or progression is actually common, and it's and the average, but it occurs on a spectrum. And for some people, it will be mild or moderate, but for other people, it will be severe. And so an awareness of this is really critical, as severe FCR can be very detrimental to quality of life. It can accentuate symptoms that are residual after completing treatment, or the symptoms of ongoing consolidation or maintenance treatment. And it can interfere with medical care and the possibility of a positive outcome. So studies have identified that there are some populations that are at increased risk for the development of severe FCR, and those populations include young adults, those with pre-existing health concerns, such as pre-existing history of depression or anxiety, or a history of trauma, as well as people who know several members of their immediate community of family or friends who have been diagnosed with and treated for cancer. All of these groups represent populations that are vulnerable for the development of severe FCR. And very critically, it's been identified that in the situation of severe FCR, there is no improvement in the absence of intervention. With mild or moderate FCR, with time, it can improve or diminish, but that is not the case with severe FCR. So no matter where on the spectrum of FCR someone's experience lies, promoting the skills and the habits that favor wellness are part of managing the anxiety of the fear of recurrence or progression. And there have been a lot of wonderful webinars and podcasts and articles created by professionals and patients, caregivers and advocates that are accessible online, and that I would refer people to if you know, who have kind of ongoing interest in this topic, since this is a very brief presentation, and I will only be able to just start to touch on the topic of wellness. In this graphic, I've used the image of a tree, and the reason for this is that it summarizes and symbolizes many themes that are critical to wellness, and these include things like nourishment, connecting with roots and fundamental values and goals, things like mindfulness, living in the moment, vitality, activity that's not exclusive to physical activity, and connecting with joy. Another metaphor or image that's useful when talking about wellness is that of fabric or textiles. And that's because fabric is a concrete representation of how weaving and interweaving leads to a material that's resilient, but also has texture and is vibrant. And the metaphor is useful because wellness is tied to the interwoven elements of an individual's life, the elements that make up the fabric of their life. And since we're all multifaceted, wellness requires multidimensional engagement of the heart, of the mind, of the body, and of the spirit. And this can be kind of free form, if you will, through promoting existing relationships with family and friends, through renewing interests, through re-engaging in work, identifying priorities and goals, through engaging in healthy lifestyle, and through connecting with the arts, with music. Or it can be more formal and employ mind-body techniques, such as meditation techniques, whether it be seated meditation or meditation in movement, such as yoga and Tai Chi, relaxation techniques, such as deep breathing, and imagery, or expressive art therapy, such as dance therapy. And while promoting wellness is fundamental to managing the fear of recurrence or progression, this must be complemented by support and treatment that matches the intensity of the concerns that an individual has. And at the kind of base of the pyramid is this concept of prevention, whereby really every member of the care team should engage in effective communication, and patients and survivors need to be provided with precise and accurate information to the extent possible about prognosis and about the signs and symptoms of recurrence or progression, since it's been really abundantly shown that in the absence of such information, there is a tendency to develop more intense symptomatology. And then this idea of matching the intensity of FCR with diversified and escalating support and treatment that we'll discuss in the next slides. So communicating with peers is one very important mechanism for addressing various stressors, including FCR. And the most common form of peer support, although this may be changing, has traditionally been in-person support groups. And it's more recent that online support communities of various kinds have become available. And there's quite a lot of information available online by societies, foundations, different organizations and advocacy groups with additional details about support communities, both in person and online. A different form of peer support that's one-on-one is mentoring. And there's a very special organization called Eimerman Angels, where survivors, caregivers, or individuals who are currently fighting cancer are matched with a mentor angel. And that's a very unique opportunity to make a connection, get advice, and experience empathy from someone who has had the same exact diagnosis and a similar experience. As fear of recurrence or progression becomes pronounced to the point of being disruptive and frequent multiple times a week, it's necessary to escalate the support and treatment for the survivor. And both national and international guidelines recommend psychological care for individuals who are distressed by this constellation of symptoms. And professionals can employ psychological care and counseling as a critical part of the treatment in such a situation. And going into the different kinds of counseling and therapy that are available is beyond kind of the scope of this discussion, but I've listed some of the different types of therapy that are out there. The traditional form is cognitive behavioral therapy. And one way to describe this is that it aims to challenge the validity of negative thoughts. It's been considered that perhaps in the situation of a diagnosis of cancer or leukemia, that this may not be the best fit, since, in fact, there are many such thoughts that are valid. And so there are newer iterations of cognitive therapy, such as acceptance and commitment therapy and metacognitive therapy, that seek to shift the focus away from negative thoughts to the individual's values and life aims, or that seek to create interventions to undermine the beliefs that lead to perseverative thinking, threat monitoring, avoidance responses, and in particular to disrupt the notion that such negative thinking and certain maladaptive responses cannot be controlled. So here I've summarized some guiding points for managing FCR from the perspective of the survivor. And these are things that I've tried to touch upon, and they include prioritizing wellness, communicating questions and concerns, and this includes to friends, to family members, and certainly to the care team, reaching out for professional support if this seems at all to be required. And finally, being kind to oneself and giving the space to be positive and hopeful. And I wanted to close by acknowledging together that even in the face of life-threatening illness, there is a really inspiring possibility for transformation and personal growth. That's an element of survivorship and that motivates people to live in a more healthy way, to deepen relationships, that leads to greater emotional strength and realignment of priorities. And I want to thank you for your attention. And I must say that when it comes to survivorship, my teachers are my patients and their caregivers. And so I want to take a moment to thank them as well.